Most people have big stories. This is incredibly personal stuff, and most women who come see me have been traumatized by the medical system. They've been to multiple doctors, they've been turned down, they've been told what they're experiencing isn't real, and they feel very, very rushed. I grew sick of the traditional healthcare system. I had to see 25 people a day, and the one thing that people wanted more and more of was my time. Medicine is an art, it is a practice, and it takes way more than 10 minutes to get to know you. You know, what are your goals? Telling your story is part of the doctor-patient relationship. And so that's why I'm creating the Casperson Clinic, where we're gonna take care of perimenopause, menopause, and sexual health needs. My vision for the Casperson Clinic is a place where when you come, your blood pressure actually goes down instead of up. So it's very welcoming. I actually used a residential designer to build the clinic, so it feels like your living room. We've got amazing coffee and books and nice lighting and lots of blankets. We've got fitness studios all around. We've got a walking track outside. We can go get lunch. This is a curated, special, time-intensive place to be. And to come to this clinic and to be able to have an exam and use mirrors and actually be like, let's look at this, let's see how things are changed, to help her be more empowered, and then we can see how hormones can help her live her best life. There's going to be one bigger visit at the beginning to get to know you. A new patient visit is going to be at least an hour and a half long, and then the membership's on a month-to-month basis. It's not just one visit. You might have side effects. We might want to change dosing, and really saying, this might take us 6 months, and then things might still change. I think so many people fail with hormones and sex med because they go to one visit and it didn't get them exactly where they wanted to be, and they never went back to tweak stuff. You know, you're gonna have questions after you visit here. Those things are easy to handle by email, by phone, by text, and really providing a safe space to be like, she's got my back. I think a big reason that people seek care for me is my expertise in testosterone. I love estrogen and progesterone too, and sex med, so it's really comprehensive, but one of my personal favorites is female testosterone. Testosterone is like this stereotypical male hormone. It's actually DEA regulated in the United States of America, so it kind of has this stereotype as being dangerous, but all bodies make testosterone, and using the data that we do have to say, let's do it safely, let's see if it's right for you, and to guide you through that. Midlife is a time when women are hit with hormone changes, which can profoundly affect their life. This is how you're sleeping, this is your energy. It hurts when you sit, it burns when you pee, you can't be intimate with your partner. Like, that is not your best life. Once you reframe it as, I want to live as healthy as I can for as long as I can, not just how long I can, then the whole game changes. What do you want to be doing when you're 84 years old? Let's aim for that. Let's see what we can change now to get you there. And that's a profound change in how healthcare is run. I have two of the biggest niches in the entire world. I have sex and I have women. They're totally underserved, like nobody's talking about this. And so started a podcast, started writing books, started speaking on stages. Now my podcast is number 5 in medicine on Apple, because the world doesn't change just by all the doctors finally learning this medicine. It changes by the women going in and being like, I've got the knowledge, I've got the education, I know how to advocate for myself. My addiction is having smart women feel more like themselves so they can go out and change the world. Everybody actually wants to talk about sex and hormones. Everybody wants to share their stories once they realize they aren't the only one going through this. You're not broken. It's actually normal to not orgasm with vaginal penetration. You're not broken that you have never had an orgasm in your life. You were never taught how to have one. They feel so broken about that, and it's like, no, you just need a little bit of education and support, and then they've got amazing lives ahead of them. You're not broken. Let's just start to dig. I love changing lives that way.